So this is one study. This is that international LCAP, and I mentioned this study because it's a great example of how you can catch these cancers at an earlier stage. And this is the one that involved almost 32,000 patients. So they took a bunch of patients who were smokers. All of them were big-time smokers. And they did CT scans, and they did sort of follow-up CT scans as well. 31,000 patients or above, and they found that of those patients that were diagnosed with lung cancer, a very high percentage were stage 1, which is that very early stage. So we are catching a lot of early lung cancers, and of those patients who had stage 1, the percentage who were alive at 10 years were 88%. I can go back to that last slide, which showed even at stage 1, the patients who were alive at 5 years was about 60%. So this is actually really encouraging data. And on a sort of superficial look at this, you say, wow, this is great. You know, we're catching a lot of patients with really early disease. So the questions, though, that this raises is, what no study has looked at, and this is the thing you have to look at for whether screening makes a difference. You take 1,000 people which get screening, 1,000 people which don't get screening, and you see who does better. You follow them for 10 years. How many people are alive here still, and how many people are still alive here? That's the only way to really definitively prove that staging works. And hopefully, if the staging works, maybe 90% of the patients are still alive, and maybe 80% of the patients who have not been screened are still alive, and so there's a 10% difference, and you assume that's a difference made up by the screening that you've done. No study has done that yet, and no study has come close to doing that yet. The other question is, we're picking up a lot of really early stage cancers in these studies, okay? So, but would these cancers have actually gone on to progress and cause the patient to die? And we have no idea if that's true or not. So perhaps you're picking up early cancers, and maybe they're getting surgery or radiation or whatever. They're actually getting an invasive treatment, but maybe those cancers would never have caused a problem at all. We have no clue. And that's why you need that comparison, that direct comparison, screening versus non-screening.